Hi, welcome to today's topic. I am your host, Dr. Sandeep Nagre. Today, we will discuss a topic that affects millions worldwide: kidney stones, also known as renal stones. Let's discuss what they are, why they form, how to prevent them, and the latest treatments available. So, let's start with the basics. Renal stones are hard deposits that form in the kidneys. They are made up of minerals and salts. They vary in size from a grain of sand to larger than a marble and can cause significant pain when they travel through the urinary tract. You might hear these referred to as nephrolithiasis or urolithiasis in medical settings. Now, kidney stones aren't a single entity. They come in different types. The most common are calcium oxalate stones, but we also have uric acid stones, struvite stones, and the rare cystine stones. Each has a unique cause and approach to management. Why do these stones form in the first place? It comes down to a mix of factors: dehydration, diet, genetics, and sometimes underlying medical conditions. When urine is highly concentrated, minerals like calcium and oxalate can crystallize and stick together. Here's a takeaway for everyone: hydration is your best friend. Staying well hydrated dilutes your urine and lowers the risk of stone formation. How do you know if you have a kidney stone? The most classic symptom is severe pain, what some describe as the worst pain they've ever felt. This typically starts in the flank or lower back and radiates to the lower abdomen or groin. You might also experience nausea, vomiting, and blood in the urine. Diagnosis is fairly straightforward, with imaging tests like an ultrasound or a CT scan, which helps locate and size the stone. When it comes to treatment, the approach depends on the stone's size and location. Small stones often pass on their own, with pain management and increased fluid intake. For larger stones, we have options like 1. Extracorporeal shock wave lithotripsy, ESWL, breaking stones into smaller pieces using sound waves. 2. Ureteroscopy with laser lithotripsy. A small scope and laser are used to break and remove stones. 3. Percutaneous nephrolithotomy, PCNL, for larger or complex stones. A minimally invasive surgery is performed. The good news is that advances in technology have made kidney stone treatments less invasive and more effective. Now, let's talk prevention. Preventing kidney stones boils down to a few key strategies. The dietary modification for kidney stones varies depending on the type of stone, as each has distinct causes and triggers. First, start with calcium oxalate stones, most common type. Cause for these stones is high oxalate levels and calcium in urine. Dietary recommendations includes reduce oxalate-rich foods like spinach, rhubarb, beets, nuts, chocolate, sweet potatoes, and tea. Ensure adequate calcium intake because calcium binds oxalate in the gut and reduces its absorption. Include dietary calcium sources like milk, yogurt, and cheese. Limit sodium intake as high salt increases calcium in urine. Avoid processed foods, fast food, and canned items. Stay hydrated. Drink at least 2 to 3 liters of water per day, preferably with lemon to add citrate. Moderate animal protein because excessive meat increases calcium and oxalate excretion. Let's talk about calcium phosphate stones. Causes are high urine pH, high calcium levels. Dietary recommendations for these stones are limit sodium, similar to calcium oxalate stones. Moderate animal protein intake. Stay hydrated with water. Acidify urine mildly if needed. Cranberry juice or vitamin C can help lower urine pH, but consult a doctor. Next on the list are uric acid stones. It is caused by high uric acid levels from purine metabolism and acidic urine. Dietary recommendations for uric acid stones is to reduce purine-rich foods like red meat, shellfish, alcohol, and sugary drinks. Also, increase alkalizing foods. Fruits like bananas and melons, vegetables, legumes, and low-fat dairy. Increase hydration. Aim for 2 to 3 liters per day. Limit fructose. Avoid sugary sodas and fruit juices. Focus on plant proteins. Reduce excessive animal protein. Key tip: increasing urine pH with alkaline foods reduces uric acid stone formation. Now let's talk about struvite stones, infection stones. Causes are chronic urinary tract infections caused by bacteria producing ammonia. Dietary recommendations include increased hydration to dilute urine and prevent infections. Limit phosphate-rich foods like red meats, dairy products, and processed foods. Cranberry juice or supplements can help prevent bacterial adherence. Finally, cystine stones. They are rare and have genetic etiology. It is caused by cystinuria or excess cystine in urine. Dietary recommendations: drink ample water, reduce sodium. Salt increases cystine in the urine. Consume alkaline foods like fruits, vegetables, and lemon water. Limit animal protein. General recommendations for all stone types: drink plenty of water to produce 2 to 2.5 liters of urine daily. Avoid excessive salt and sugar. Moderate animal protein consumption. Use citrate-rich foods like lemon, lime, and orange juice to prevent stone formation. Lifestyle adjustments. Maintain a healthy weight and manage conditions like gout or hyperparathyroidism. If you've had a kidney stone once, there's a 35 to 50% chance you'll have another within 5 years. So prevention really is a key. To wrap up today's episode, we've covered what renal stones are, why they form treatment options, and actionable prevention tips. If you or someone you know is struggling with recurrent stones, consult a healthcare provider for a personalized plan. Thanks for tuning in. Please share it with your colleagues, friends, or patients. Please don't forget to subscribe and join us next time as we explore another important medical topic. Stay healthy, stay informed.